The first step in placing the jaw elevation device on the patient is to place the positioning line on the head support and align that with the patient's lips. So we're going to lift the patient's head, placing the head support underneath, and verifying on the side that this positioning line is in alignment with the patient's lips. The next step is to place the single-use mandible cups into the vertical support arm. It's marked red for red and green for green. Now place the vertical support arms halfway into the head support. They're marked red for red and green for green. I'm just going to slide this halfway in and halfway in. At this point, it's very important to depress the A button on top of the vertical support arms, lowering the mandible cups into their most low position. After sedating the patient, you want to elevate the patient's jaw and verify that you have end-tidal CO2 on your monitor. While maintaining this position, go ahead and slide the vertical support arm in towards the patient's angle of his mandible, which I'm palpating. Make sure that the pad cradles underneath the angle of the mandible. While holding this position constant, swap hands and slide in the other support arm right underneath the angle of the mandible. If necessary, you can adjust the jaw elevation device by pushing button A on the top of the vertical support arms and adjusting the mandible cups. This way you can maximize your end-tidal CO2 and validate that you have end-tidal CO2 waveform on your monitor. The JED also has two channels right and left on each mandible cup. This is for securing your end-tidal CO2 sampling line. And lastly, to depress and release the device, there's two buttons on either side of the lower vertical support arm. Press and release the arms, disposing of the single-use mandible cups.
The JED can be used on any jaw 10 to 21 centimeters in width. This corresponds with a child around age 6 up to most large adults. Once you lie the patient's head down on the head support, verify the positioning line is in alignment with the patient's lips. Attach single-use mandible cups. While applying the JED arms, it may be necessary to palpate where the angle of the mandible is located on the obese patient. Adjust the cups if necessary. Dispose of the single-use mandible cups.